Good Monday morning, everyone. Let's kick off our week with some good news for some people who thought they were out of luck because they missed Medicare and individual open enrollment season.
Well, there are still circumstances where you might be eligible for insurance coverage. Colleen Gimbel with Berwick Insurance Group is here to tell us what those circumstances are. Colleen, I'm so glad you're here today. Thank you.
Yeah, it's great to be back. And, I think the misconception is that there's always, you can only get in insurance during open enrollment. Now, for a lot of people, that is the case. But there are certain scenarios and circumstances, and I want to specifically talk about Medicare today. So if someone is turning 65, obviously, and they're getting on Medicare for the first time, they'll have a special enrollment period or something called an initial enrollment where they can enroll, and then if they want to change an open enrollment later in the year, they can do that. Just to remind you, open enrollment is October 15th to December 7th. But there's also cases where if somebody moves and they change zip codes, then they can have a special election period where they can go look at their plan. So it's really a good idea to check if your scenario changes in any way, to call an agent, call Berwick, and find out what the circumstances are if you can change your plan or if you need to change your plan. You don't have to change it by any means, but if you missed open enrollment, yeah, you're going to be a little bit out of luck unless your circumstance or scenario changes. Another really important demographic of people that we don't talk about very much and that I just barely touched on last time and what I wanted to talk about today is the people who are on Medicare and Medicaid, or Access. In Arizona, we call it Access. People who are on Access but who are also Medicare eligible, there are special plans for them, and they can basically enroll in a plan just about any time throughout the year. So they don't have to wait for open enrollment. They have a lot of additional support from the state, reduced co-pays and things like that when they go to the doctor or have a hospital stay or something. I was really excited that after the last time I was on the show, I personally got a call from a viewer who was like, well, can you help me with this scenario? And I got her with one of our insurance agents, and I heard that we got her on a plan, and she is in a much better case now because she's not just by herself trying to figure it out. So she got a good plan, and we took care of her. So thank you to you guys, but also we're really glad that we were able to get the word out and people were able to know about that in particular. So that's kind of an underserved population, people that are Access and Medicare.
Well, and this is exactly why we have you continue to come on, is because there are people out there that don't realize that these circumstances fit them specifically. And the first step always is getting that education out, getting the word out. And, she gave you a call, you helped her out, she got on a great plan. And so a lot of people are probably asking, does it cost if I come to Berwick and you help me get to that next part of my plan?
Right, and it doesn't cost anything for us to help you. Mm-hmm. And even if we don't put you on a new plan or you're not eligible or whatever the case may be, let us just take a look at whatever it is you need help with. Because if we can just answer a question and make you feel more comfortable and at ease with what you've got, then we're happy to do that. That's what we do. That's what we get paid to do by the carriers. Tell us, like the United Healthcares and the Humanas and the Aetnas, they ask us to, Blue Cross Blue Shield, they ask us to help agents or, help clients, and they compensate us to do that. So we're very happy to just answer anybody's questions as well.
That's incredible. Colleen, I love that you've come on. You've given us a personal story of just how much Berwick Insurance is helping others out there. Let's really give a rundown of all the services that you do provide.
Yeah, absolutely. So health insurance, we do the Medicare. Obviously, we've been talking a lot about that. Individual under 65, and also group insurance, which is, there's so many regulations around group insurance. So if you're an employer, probably not watching this at 10:30, but maybe you're taping it, so you'll see it later.
Yeah.
Let us talk to you about your group insurance, because there's so many things that the government, with the Affordable Care Act / Obamacare, that's really important that you understand what the regulations are for you as an employer. And we've got some great strategies to help you save money there. We also have the property and casualty or auto and home sites. We have a full Berwick Heims, it's our partner company, but we can help you with anything on the auto and home side, which everybody needs help with that. So, and then we have life insurance. I mean, pretty much anything in the insurance industry, commercial insurance if you own a business and need to insure your property. So I know I mostly talk about healthcare when I'm on here, but we really do cover all of the different kinds of insurance needs that you might need.
And even within, my time being an adult, I guess, and, going through insurance and doing all of this, things have changed so much drastically that it really is important to have a helping hand.
Yeah, and why not let somebody who's an expert in the insurance business give you the answer? I mean, that's really trying to figure it out yourself. You're welcome to do it, and we love it when people do that and have, come to the table with research, but you don't have to. I mean, that's our job. We can take all the guesswork out of it for you.
And again, even if you're just not sure if you need help, call. Ask questions.
Just ask a question,
There's no cost to do that, and you might find out some information that you didn't know.
Yeah, and thank you for you guys too, because I don't think that this woman, had she not seen this segment that on this show, that she would have known that she was eligible for more health care. And health care is all about preventative. If we can get people to the doctor before they need to go to the doctor, we're all going to live longer, healthier lives. And there's a statistic out there that says Americans are living longer, but we're living longer sicker, which is not what we want to do. So I appreciate you guys letting me come on and talk about it, and I was so glad that we at least had we had lots of people call us, but one in particular, she reached out to me personally, so I knew that I just saw you, I need to talk to you, so that was great.
You're like BFFs now with people that watch. I love that.
I'm so glad.
Well, Colleen, we absolutely love having you on. I think it's great. You're helping
you.
so many people in our community. Please continue to come on, and
I
we'll
will.
see you next time.
Thank you so much, guys.
Yes.
And whether you need individual, group, or Medicare insurance, just call 745-2300 today to speak to a Berwick Insurance agent, or you can log on to WeKnowHealthInsurance.com.